what I want people to know is that these people are dying without anyone next to them. And it's hard because usually the only link they have to their family is through us. If we go in and we FaceTime or if we Skype or whatever medium to communicate, it's hard because you know that it will never replace being able to be there. And I feel like I'm invading in a sacred space of how this is the last moments they might share with their family member. Who am I to be privy to that moment? And I think that has been the most challenging part of this job so far. The gravity with which I enter a room is so much heavier now because now I'm realizing that every single time I walk in, I put myself at risk.
Do you feel like you have what you need to keep yourself protected?
I don't feel like I have enough. I think that when it comes to personal protective equipment, I think that anything less than a hazmat suit for nurses and doctors and anyone who's working in areas where there is a high risk of contracting this virus, I think it's not enough. Without anything covering my neck, without anything covering from my knees down, those paper gowns that we have they're not even fully waterproof.
Governor Cuomo says the curve of new hospitalizations is flattening.
I think it's too soon to have hope. I say that because even if we reach that peak, there will be a plateau, and my patient ratio, my patient safety, my stress as an ICU nurse won't diminish at all. It's still going to be bad in hospitals for a long time. It doesn't give me much hope because people are still going to be contracting this virus and still people are going to be getting sick. And it makes me wonder, once the social measures are lifted, will people have a higher rate of contracting this disease again? I hope not, but I think it's too soon to tell.
Why did you want to come forward and talk about your experience?
I think it's really important that the country understands how our healthcare system is failing the people we are trying to protect. I became a nurse because I wanted to care for people. I question how many more healthcare workers, how many more nurses and doctors have to die before we realize that this isn't what we're living in, what our society has created as a healthcare system is not sufficient.